I just wanted to make one quick announcement that's exciting. The Department of Social Work is hosting Temple Grandin on Wednesday, March 1st at 6 p.m. at the University Club. There will also be an online option for those who can't attend in person, but it's also an in-person event. They haven't opened up registration yet, but I wanted to mention it as it's just 1 month away. If you want to save your time in your calendar, if you're able to make it, should be a great opportunity to hear her speak. I'll put that in the chat as well, so you can look for that via email. Yes, Emma also has an announcement to make. Do you want to mention that, Emma, yourself?
Sure. Hi, I'm Emma. I'm the inpatient social worker on the CAD unit. I'm also on the Diversity Council with Dr. Kettle. So we've taken on Autism Acceptance and Neurodiversity Month. That's how I'm going to label it. It was just so funny to see that this talk came up right whenever we started really getting into the planning for this. I would love to talk to you, Jesse, Elizabeth, and Kelly, about perhaps doing this presentation in April for the hospital group. Like I said, we're going to do autism acceptance and celebrating neurodiversity for the entire month.
That's awesome. I think we would love that.
That would be awesome. Great. Thank you. Anybody else that, feel free to email me. I'm excited to have ideas and things to go on throughout the month. Thanks, Carla.
Exciting. Thank you.
Thank you, Emma. Okay. All right. Well, without further ado, welcome and feel free to go ahead.
All right. So thanks everybody for being here. So myself, Elizabeth, and Kelly are going to be talking about neurodiversity today. I'm sure that this is a word that most of you have heard coming up a lot recently. We're hoping that this will be a good introduction. Maybe you know a lot, maybe you just heard it, but you don't really fully understand it. So our hope is this will be a nice introduction and also will inspire you to maybe read and learn more after you hear what we have to say. So my name's Jessie Northrup. I am a clinical and developmental psychologist, and I'm an assistant professor in the Department of Psychiatry here. And my research is really focused on very young autistic children, so preschool age and even earlier. And I'm particularly interested in parent-child interactions. And I am really passionate about neurodiversity. So I don't have lived experience with autism, but I care a lot about autistic people. And I've been reading and learning about this over the past few years. So it's kind of my role here. And I'm going to let Elizabeth introduce herself.
Hi, I'm Elizabeth Rutenberg. I am a current undergraduate student here at the University of Pittsburgh. I have a lot of lived experience with autism, and I'm part of the Pitt Autistic Students Union. And I'll pass it to Kelly now.
Thanks, Elizabeth. My name is Kelly Beck. I'm an assistant professor in the Department of Psychiatry. I am also a licensed professional counselor, and I work with adults on the autism spectrum and other neurodevelopmental conditions. I do have lived experience with neurodiversity, but I'm not autistic. And I'm just really excited to talk today about the things that we've learned from our community work.
All right, so we just have a few acknowledgements to make. These are either organizations or people who helped put together or helped us with parts of this presentation. So we're going to be talking about some of the research out of the Academic Autism Spectrum Partnership in Research and Education. Big thank you to the Pitt Autistic Students Union who helped us come up with some of the tips we're going to be sharing with you today. PARC is an amazing research, Pittsburgh Adult Autism Research Collaborative that Kelly started, and she'll be telling you a little bit more about that. And then some of our colleagues here at the React Lab, Kristen McKenzie, Caitlin Connor, and Shalini Sebastian. So a little bit about what we're going to do today. So our learning objectives, we hope that you're going to understand the concept of neurodiversity, that you can summarize some of the issues that are important to the neurodiversity movement, and then that you'll be able to apply suggestions to improve interactions and advocacy for autistic clients and families, or autistic people that you interact with. We know not everybody is a clinician on the call, but even if you're in research and you're going to be interacting with autistic individuals. And then at the end, we're going to learn about some of the neurodiversity related initiatives here at Pitt. Just so that you know about some of the stuff that's going on. So I am going to pass it off to Elizabeth to tell you a little bit about neurodiversity and the neurodiversity movement.
Hi, so neurodiversity movement is about neurological diversity, and this can include lots of different things such as like dyslexia, ADHD, autism, etc. It's about how humans interact, think, feel, and experience the world in different ways, but that none of those ways are inherently inferior to others. That there's no one right way to think or learn, behave, etc. It acknowledges that all of us have our own strengths and weaknesses, but that they're all equally important. So a note on terminology, when we're talking about individuals, we'll use the words neurotypical, which refers to having a typical way of developing and thinking, and then neurodivergent, which is something that differs from the norm or the majority of people. And just like you wouldn't say a single person is diverse, you wouldn't call a single person neurodiverse. You could refer to a community or group of people as neurodiverse, but a single person can be like neurotypical or neurodivergent. Right. The neurodiversity movement is a social justice movement that extends upon the previous work of other disability advocates, especially as it pertains to the social model of disability. So the social model of disability was developed in contrast to the medical model of disability. So the medical model of disability says that it is the impairment itself that is the issue, and that it is the impairment that should be cured. Versus the social model says that it is society's lack of accommodations and support that causes disability. And so the neurodiversity movement and the social model of disability as a whole focuses on providing support and accommodations. Okay. So just to further emphasize this kind of idea that difference does not inherently equal deficit, oftentimes when we talk about autism, it's framed in a very deficit kind of way where all strengths are in spite of autism and all weaknesses are because of it. But what if we refer to like neurotypicals this way, saying that they had an obsession with ongoing social communication or a need for constant social stimulation or like stereotyped or repetitive beliefs about social interaction. So it's really just about framing, and it doesn't mean that the weaknesses don't exist, but we can change the way we kind of look at it. So the double empathy problem says that when an autistic person and a non-autistic person are interacting, both people will often struggle to understand what the other is saying. But the implication is that it is on both parties to kind of work together and adjust how they're communicating in order to be able to understand each other, that it's not just on the autistic person to change their method of communication, but it's on both parties. Because studies have shown that autistic people generally don't have an issue understanding each other and don't have a lot of miscommunication between each other, and that miscommunication only starts when interacting with neurotypical people. Okay. Most of you have probably learned that we should use like person with autism instead of autistic person. It's kind of person first language instead of identity first. I mean, obviously you should ask whoever you're speaking with how they prefer to be referred to, because everyone will have their own preferences. However, we tend to use identity first language, saying autistic person, because one, it shows that autism cannot be separated from the person and that it's an identity and something to be proud of instead of something to be hidden or ashamed of, like person with autism implies. Okay. When we refer to the autism spectrum, we don't mean a linear spectrum like you see on the left, but we're talking more about something like you see on the right. It used to be that autism was classified into like high functioning versus low functioning. But one, this is used to disenfranchise autistic voices, saying that low functioning autistic people aren't smart enough to be able to advocate for themselves, and high functioning autistic people could never possibly understand the experiences of people with low functioning autism, and so they're not able to speak on behalf of the community. And also, it just doesn't really make sense because different people are going to have different support needs in different categories and in different circumstances. So if we look on the right, we'll see that it's more specific to what an individual person will need help with, and it's better suited to be able to actually provide accommodations and support. So just to further emphasize why this kind of linear spectrum doesn't make sense, think about a person that is highly verbal, very smart, lots of intellect, but has like crippling social anxiety that they're not really able to attend any social events or really leave their house, versus someone who we'd say needs a lot more support, has maybe some intellectual disability, but is able to attend social events and go with their family, and maybe isn't verbal, but they're still able to communicate using alternative means of communication. So which one would we class as high functioning or low functioning? Like, it just doesn't really make sense. Yeah, so prefer the right way, which is on the right, which shows like specific needs and is more specific. Okay, so further going off that, we're looking for accommodations and support, not cures for autism. Autism can't be cured without taking away what makes that person themselves. Autism is a part of the identity and a part of the way that you experience the world. It can't just be taken away without fundamentally changing who that person is. So we're focusing on interventions that improve the quality of life and increase opportunities and access to self-determination, communication, self-advocacy, and independence. And that it's society and not just the autistic person that needs to change. Masking is the idea that autistic individuals, especially marginalized groups such as non-binary people, people of color, and women, learn to hide their autistic traits to avoid judgment. However, in most circumstances, this doesn't really work, and they're still seen as being odd or strange, and they don't really fit in. But meanwhile, it's also taking an immense toll on mental health associated with higher risks of anxiety, depression, suicide, and causing a lack of self-identity, low self-esteem, isolation, and also causing later diagnosis and also misdiagnosis, especially with things like social anxiety, borderline personality disorder, and eating disorders. It's kind of the standard for autism treatment used to be applied behavioral analysis therapy, or ABA. But this has been widely condemned because it focuses on teaching autistic people to mask in order to make them appear more typical, but doesn't actually make them feel any better. If anything, it makes them feel worse. It just makes the people around them feel better because who they're talking to is more normal. So, nothing about us without us. This says not just listen to autistic voices in the movement as a whole, but also listen to the autistic people in your life and the autistic people that you're interacting with about what they need and want. This isn't just a broad thing that doesn't apply to everyday life. It does. It applies to each of us on an individual level.
Thank you, Elizabeth. So now we're going to start talking a little bit about how you can apply some of these ideas in your everyday life. I'm going to start us off by talking about talking to parents, and then Kelly's going to talk more about interacting with autistic individuals that you might interact with in your practice or through research. There's probably a lot of you on this call that interact with parents at various stages. And I think something important to acknowledge is that parents are, from the time probably before they had a child, have been inundated with the messaging that exists in our culture around autism. And especially historically, a lot of that messaging has been extremely negative. So a lot of times you might be interacting with parents at the very beginning with them already having sort of a strong negative association with autism at the point where they get the diagnosis or at the point where you meet them. And so I think that it's really, really important for clinicians and people interacting with autistic people and their family to be aware of the neurodiversity movement so they can help parents be aware of it and maybe start to shift their thinking. So the first thing I'm going to say is that it's important to start early. If you interact with parents at the point they get a diagnosis or very early in their journey, introduce parents to the neurodiversity movement, and perhaps even more importantly, to the idea that autistic adults are an important resource. I think that when parents get a diagnosis of autism, they are given a lot of resources, right? But very, very rarely are autistic adults put on that list of the resources that can be helpful to them, which that ability to listen to people who have lived experience with the thing that their child is going through or their child is living is incredibly important. So letting parents know about that early. And one way you can do that is a book that was created by the Autistic Self-Advocacy Network, ASAN, that was written for parents. So it's called Start Here. It's freely available to download like as a PDF version. And I highly recommend, if you work with young children or with parents of kids, of any kids or adults of any age, to look at this book and read it yourself. Because when you think, I'm going to be talking about and giving some tips about language use and stuff, but honestly, when I read this book, it really helped me see what is a strength-based way I can talk about autism. How can you be realistic about challenges while still being strength-based about the identity? And so I really highly recommend it for parents, but also even for clinicians. I love this part they have at the beginning where they say, your kid is still the same kid as they were before they got their autism diagnosis. All the things you love about them haven't changed. Your kid loves you and they know you love them. Now that you know that they are autistic, you are going to be able to understand them better. So I just want to go through, I have a few slides on tips about talking to parents. And I say talking to parents, but I think these tips really also apply to writing reports. If you write diagnostic reports or kind of any written communication that you might do with parents, which in some ways can be even more influential because a lot of times if you do diagnostic assessments, parents are just so overwhelmed in the moment and the report ends up being this really important thing. So, in line with everything that Elizabeth just talked about, think carefully about how you can make your language less deficit-based and more strength-based. So part of that is thinking about this idea that difference does not necessarily mean deficit, that not all differences are deficits that need to be fixed. I just want to take a minute to say this does not mean that the neurodiversity movement or I am saying that a child won't need support or that interventions are not going to be an important and helpful part of a child and their family's journey, right? But I think that there's a tendency for every aspect of autism to be categorized as a deficit and talked about as a deficit in the reports. And so thinking about how can I begin to see things as differences and think about, okay, what are the challenges that this this person might face. Another thing, it's probably already the case that you think about focusing on strengths. I think that's something as clinicians that we learn from very early. But one kind of subtle thing I think you can shift is make sure when you talk about strength, that you don't talk about the strengths as separate from the autism while blaming all the challenges on the autism. I think that's a common sort of almost accidental thing people might do, where they're sort of saying, well, they have autism, so all these things are, hard, but it's so great that they have these other strengths. All of those things are a part of who that person is, and it's likely that all of those things are common in autism. You want to validate parents' concerns and fears. You're going to be getting parents who are, coming in with real valid concerns and real valid fears about their futures. But we can help shift the way we talk about what those challenges are. And the real shift is about not blaming the challenges solely on the autism, and especially not blaming the challenges on the child. It's acknowledging that many of the challenges that autistic individuals and their family face are because of an unwelcoming, unaccommodating society, right? And so we want to acknowledge that. That's in fact, a validating thing for parents too. And I'm going to talk about this a little bit more, but there's a sense in which parents feel like, well, now I have to go out and fix my child so that they can have a happy life. And the neurodiversity movement is saying, you don't need to fix your child. It can be, you can support your child in being able to interact in this world better, and also help your child have a happy and healthy life by finding parts of the society that can accept them and advocating. So here are just a couple of ideas about how to shift language. So instead of her autism means she struggles more with communicating, but it's so great that she's so socially motivated. So this is like kind of separating the strengths from the autism. You could say something like, she's very socially motivated and also communicates differently than other kids her age. Both of these things are common for kids on the spectrum. So putting them together, these are both parts of her and both parts of her autism. Children with autism often struggle to make friends. So this is an example of kind of blaming the autism, blaming the child, right? Another way of putting this is, we still live in a society where lots of people aren't very understanding or kind about people who are different. So children on the spectrum often need extra support to find friendships and communities where they can thrive. So in this sort of alternative way, we're acknowledging that part of the pain and struggle that autistic people go through is because of people not being very kind or understanding. And we also acknowledge that it's not just that their child is going to need to be fixed, but that they might need extra support kind of finding those friendships that are accepting. There are lots of intervention options for helping your child learn to socialize better. So similarly, this one is saying, all we need to do is fix your child so that they can socialize better. Again, we can reframe that. People on the spectrum tend to communicate and socialize differently, and that can be a challenge for them when interacting with people who don't understand. Your child will need more support in being understood by others. So similar to the one above, we're framing things as differences rather than deficits, and we're framing the challenge as not just because of the person, but also because of the society they live in. I think a place, if you start to learn more about the neurodiversity movement, and depending on how much you've been following this, you might know that in the social media sphere, where there are people of all kinds of extremes, there can be a real tension between parents and advocates of the neurodiversity movement. And I think social media is not a good place for discussions like this, and there really can be real contention there. But when it comes down to it, what I really see is that there's a lot that parents and the neurodiversity movement could have in common in terms of what their goals are. And I think that will be greatly improved if we can help parents know more about what the neurodiversity movement is saying and how it applies to them. I would say that the goal of autistic self-advocates, and the goal of parents is for their autistic child and autistic people to have happy, healthy, fulfilled lives, right? And the difference between the medical model and the neurodiversity movement is that the medical model says, and so in order to do that, we just have to fix them, make them normal, and then they'll have happy, healthy, fulfilled lives. Whereas the neurodiversity movement acknowledges that there's more ways to do that, and that way of doing things can in fact be harmful. So I think acknowledging with parents and talking to parents about the fact that helping their child is not just about getting the exact right interventions and supports in place, and that a part of meeting this goal is helping their child be their authentic self while navigating a neurotypical world. We want to, a part of a child having a happy, healthy, fulfilled life is giving them a sense of pride in themselves and helping them find autistic affirming communities as they get older. I am such a strong believer in the idea that parent and family well-being and mental health matter. And I think that the neurodiversity movement is really in line with this. Parents often feel that what's happening is society is saying, okay, your kid has autism, go out and fix them. Go do everything in your power to fix your child. And they feel like they need to change their entire family life to do every kind of intervention and all these things. And, you know, the neurodiversity movement really does give a different kind of idea about how to think about that pressure in terms of saying, you know, what's also important? Just, you know, loving one another, having family time together, you know, listening to your intuition. And it's not to say that interventions aren't helpful, but it's almost to say, like, let's think carefully about what we're focusing on, and also leave room for other things that matter, like parental self-care, mental health, and well-being. And then the last thing I'll say about that, I tend to talk a lot, is that the social model of disability, you know, which says that we need more support and accommodation rather than fixing things. You know, if you think about that, what you're saying, the way in which I think that really applies to parents is it doesn't put everything on the parent, right? It doesn't have to just be the parent's responsibility and then by extension, the child's responsibility. The fight here, the advocacy here is that society should do a better job supporting people. Society should do a better job supporting these families. And I think that's something that parents really could get on board with. All right, and then the last slide here is about discussing controversial topics. So there are two primary controversial topics that I think could come up for you. Probably the first one would be the topic of ABA, and then also the topic of Autism Speaks. And so I'm going to try to give some general advice on discussing controversial topics with parents, because this could come up in kind of a number of different ways with parents. And I think the most important thing is, if you're a clinician or a researcher who interacts with parents, get informed about the controversy. Parents are going to talk to you about it regardless. Even if parents don't talk to you about it, they might hear about it. They might find out about it on social media accidentally because they posted something and then got into some kind of big argument. And so we need to be informed so we can help parents be informed, and then to help parents to make an informed decision for their child. So I'm just going to give an example. You may have heard that a lot of autistic people believe that ABA is harmful, right? So what are the reasons why autistic people think ABA is harmful? They believe ABA is harmful because it teaches autistic people to hide their autism, because historically and likely still today in many places, it has used sometimes cruel punishments as a part of that teaching, and because it doesn't take emotional experiences into account. That it's this purely behavioral treatment, right? When we understand that why, and when we can communicate that to parents, then they are able to advocate for their child. I would assume that a lot of parents could agree that they don't want a treatment that does these things. And so even if a parent decides, well, I'm still going to do ABA because it's my only choice, or I think it's going to be helpful, or they make that decision, they then can be there, in their family, looking at that. What are the goals that these people have for my child? Are they just teaching my child to hide their autism? Do I feel comfortable with the methods that they're using to teach those things? Do I feel like my child's emotional experience is being taken into account, right? So parents can advocate for their child when they understand what to look out for. All right, so now I'm going to pass it off to Kelly to talk a bit about interacting with autistic individuals themselves.
Thanks, Jessie. Yeah, so this next section, I will talk some about suggestions that have come directly from our work with the autistic community. And we'll focus in on tips that are helpful working with autistic people, but many of these will likely be relevant working with a variety of neurodivergent people in a broader sense as well. And just wanted to comment, I know Jessie said this a few times, but I know many of you are here because you're committed and you're passionate about this topic and about this community. So it may be that you already do many of the tips that we're suggesting, and probably have a bunch of other tips and techniques that you're using, which is awesome. And so I guess the message is that you're a part of this movement. And so together we can spread this message through society and through your personal and professional networks so that a broader audience really is able to benefit for some of the suggestions that we're covering today. Next slide. Just tried to scroll and realized you had it. Okay. So I'm going to talk first about, to give some context, just finished this really cool research study where we did interviews on mental health service needs with the autistic community. And we interviewed just about 60 individuals. You see some categories here with autistic adults, teenagers, parents or carers, and mental health providers. And just to know, like, not all these groups are mutually exclusive. We have quite a few autistic individuals in the mental health providers and in the parent group as well. So we found a lot of really interesting things. That's for another day and another presentation, but I thought you'd be really interested in this one. Surprising finding that we asked individuals when we did these interviews, we asked them to tell us a story about a recent time they felt out of control of their emotions. And the #1 setting for meltdowns or emotion dysregulation was healthcare. On the way to a healthcare setting or in a healthcare setting, sometimes both. And so I'm not saying this to sort of like shame us all, but more to like reflect on that these things are happening in settings where we have very well-intended people that are committed to service and helping others. And we see that this, at least in our sample, this was one of the #1 places where they were having the most difficulty. So some context to that finding, when we really looked into the stories and talked with our partners, was that healthcare interactions, this could be mental health care or dental care or physical health care, interactions can be inherently disruptive and stressful. A lot of the environments are not sensory friendly. It takes a lot of steps to get to a healthcare appointment, scheduling it, accessing it. I would say pervasive in this study, there was a pervasive feeling of a lack of control. So whether that's like not understanding what a healthcare provider was telling them or feeling like they didn't have the space to make a choice or didn't feel like they had the support or feel safe to make a choice, informed choice about their care, and a really pervasive feeling that they weren't being listened to and that they were not being heard. And so here are some of the suggestions that we've been thinking about, and we're trying to spread this message throughout the community. Is in line with this movement and the social model of disability is that the system and society needs to change. So we need to make access to healthcare easier and more successful. Some wishes would be some sort of centralized file within a healthcare system management about what are an individual's communication needs, what are accommodations that they need, and can that be more centralized so that maybe you're doing this great work in CAD and and you know all these things about your clients, and you've worked on individualized communication and accommodations, how do we translate that to their primary care provider and their dentist and other things? So thinking about how we can make access a little bit more successful and centralized. Sensory friendly rooms. In general, we have a big issue with sensory sensitivity and healthcare environments. So really, like maybe even asking your clients and working with some partners and making sure that your office is more sensory friendly, and that there are spaces that maybe someone can go to if they needed to take breaks and things. Contacting provider offices. This was really a key part of a lot of stories that we heard with meltdowns, like who they were talking to on the phone. Maybe they really loved their doctor, but the person that was scheduling with them, they felt really unheard, and it was really difficult to make the appointment. A lot of people were saying they would need someone, a friend, to schedule for them, things like that. And last minute changes are very disruptive. If someone has to go through all these steps to get to an appointment, a last minute change can be really difficult. Some provider suggestions, as I mentioned, I'm sure all of you do a lot of these things already, but how can we spread the word more broadly, given your passion and expertise? So the biggest thing is listening. Like, listen to the autistic person. They know themselves best. And making accommodations. Are you, so, you know, for individuals that have less speaking, are we considering augmentative communication devices? Are we considering making social stories, allowing for processing breaks after each statement? Generally checking for understanding and making sure that you're listening to the person. Speaking really concretely and specifically and not vaguely. Giving concrete choices with images. Just really thinking about this idea that thinking like if you are neurotypical, you're viewing this interaction from a neurotypical brain. And so really like thinking about how can I be more intentional about making sure that our interactions and our communication is more inclusive of someone that has a neurodivergent brain, right? So they're maybe seeing things differently, going back to that double empathy problem. So being patient, allowing time for someone to make choices. Maybe they're not going to make a choice in that session, and encouraging them to talk to a trusted person and what the steps would be. Go to the next slide. So this work isn't just ours. There's this Aspire group, which is a really amazing group in the United States doing community engaged work through their autistic adult research group. But they are making a set of toolkits for healthcare providers, which we have linked in a few slides. But the top 5 barriers that came up in their research as well was fear, anxiety going related to a healthcare interaction, not being able to process information fast enough to participate in real-time discussion about healthcare. That came up in our stories as well, where people were giving them a choice. They couldn't make it fast enough, and then they felt like they were being involuntarily sedated, or a choice was being forced on them. There's concerns about cost and access to care. This idea of sensory sensitivities and that facilities are not inclusive for individuals that are neurodivergent, and difficulty communicating with providers. And so some of the tips that they have here in the Aspire group are to give individuals time to process what's been said, similar to our list of tips. Yes, there are many more tips on this website. Making sure people are ready to move on, encouraging people to prepare in advance what they want to discuss, and writing down information.
I'm just going to jump in to say there's a lot at this Autism Health website, including a whole very easy to use process for autistic individuals to make their own sort of accommodations report. And so if you know people who you work with people for whom that would be helpful, it basically walks them through a number of questions about their preferences for, how communicators can interact with them and communicate with them and what they find helpful. And then they can share that report with providers ahead of time in order to, improve the likelihood of a positive experience. I'm going to pass it over to Elizabeth. She's going to talk a little bit about some of the things the Pitt Autistic Students Union said would be helpful for people to know.
Yeah, so these are some tips from a little bit closer to home. So the first one is, especially in sensitive situations that come up a lot in healthcare, there's this tendency to judge body language, especially as being disrespectful or lying, but just acknowledge that they might just be being autistic, and don't take offense or assume that they're lying just because of body language. Next, even if they have a support person with them, still talk directly to your patient or your client. Just like when you're working with a translator, you still speak directly with your client and not with the translator. Using alternative means of communication or needing a support person doesn't mean lower intellect or an incapacity to understand what's going on inherently. Next, be concrete and specific. What might seem concrete and specific to you might not to an autistic person. So don't get annoyed if they ask for clarification. It's not being pedantic or annoying. They just genuinely don't understand. Okay. Next, similar to what we said before, using forms for people to be able to submit questions either later or ahead of time for them to, if they're uncomfortable or unable to communicate face-to-face, or for those with lower processing speed that might need to talk things over with other people. This can also help to increase patient compliance, because a lot of issues with patient compliance arise when they don't know what they're supposed to be doing or why. So if you allow them to ask questions later, it kind of alleviate some of those issues. Next, like Jesse said, listen to the autistic individuals about what accommodations they need. No one is going to know better than that person what it is that they need for themselves. And lastly, make sure expectations are the same for both parties. This kind of harkens back to that double empathy problem, where a neurotypical person might ask for something with the expectation that it'll be negotiated upon, but that a neurodivergent or autistic person might just ask for exactly what they want without this kind of expectation for negotiation and compromise. So that can create a lot of frustration on both ends. So if you kind of discuss beforehand what the expectation is, it can help to alleviate some of that. Okay. Now I'll pass it off to, not actually, back to Kelly.
Kelly, did we lose you? Oh no, we might have lost Kelly right before she was going to talk about all the awesome things that she's leading here at Pitt. Well, we might be able to take a minute, take a little bit of time while she's getting back on to answer questions that people might have now, because right now we're going to be sort of transitioning to talking about some of the community engaged work that's happening here at Pitt. So if anybody wants to unmute or put something in the chat, we'd be happy to start answering questions or have some discussion.
Hey, Jesse, this is Dr. Kettle, and I have a short question. Maybe I missed them. Sorry, I had to log in late. Will you guys at the end or at some point provide a list of these resources? Because I feel that these are great resources, and I love it when we have people who already have like a support system or those written documents. But I feel like sometimes I'm putting another burden on the family by saying, oh, you should have a support person, you should have these forms, and I don't know how to direct them. Is there a good site or website? I mean,
I think if you're talking specifically about families engaging with healthcare, that website that I put up earlier, which was autismandhealth.org, Now I put it in the chat too. autismhealth.org
Okay.
has so many resources. I mean, that, like, if I were going to give families one thing, that's what I would give them if we're specifically talking about sort of engaging with the healthcare world. But in terms of neurodiversity in general, we can definitely like share, you know, everything that we put in our slides, like the ASAN, Autistic Self-Advocate Network, is a really great resource, and they're the ones who made that book for parents. And, you know, potentially we could put together a bigger list. And I think that, Carla, did you say they'll make these slides available?
Well, if you want to share the slides, but we can definitely share all the links, like when we
Okay.
send around the continuing education information. I don't think that addresses the issue about asking parents or autistic individuals to do one more thing, but I guess it would be the idea that the benefit of doing that outweighs the burden, but.
Kelly, sorry, we were just starting to answer questions, but I see you're back, so you can.
Sorry, I'm at war with my UPMC laptop. Yeah. So do we have time for these last few slides, or do we want to just stay with the questions?
I think we have time.
Okay, so I'll quickly go through the community engaged work that we're doing here at Pitt that we're really excited to share with everyone. So the PARC group Jesse mentioned on the opening slide, that's our self-named Pittsburgh Adult Autism Research Community Collaborative. It's a group of 8 adults and expanding. Autistic adults, parents of autistic children and of autistic adults, and community allies that meet monthly with our research program. I co-lead the PARC group with Jamie Upshaw of Autism Urban Connections, Inc., which is a community organization supporting autistic families from Black and African American communities. And we work together to make sure that the science that we do here at Pitt is meaningful to the autistic community, that it's inclusive, and we learn a lot from our amazing PARC group. So related to our topic today, when we ranked our research priorities last year, the top 2 research priorities that the group generated and then ranked was teaching community healthcare providers, including mental health care providers, how to be more inclusive and supportive of autistic people. And the second was, even though it's a adult focused group, really one of the top priorities that keeps coming back is training school educators on how to make schools more inclusive and supportive of autistic individuals and also neurodivergent students. So it just really speaks to PARC that their focus is improving the community overall and not just things related to the adult community. So in response to these priorities, we do have a lot going on here at Pitt related to these 2 things. So our recently funded Pittsburgh Autism Center of Excellence, which you all learned about at a previous seminar, we have what's called our Dissemination and Partnership Core. And our 3 goals in the Dissemination and Partnership Core are to authentically engage with the autistic community and their allies. And so PARC is really the centerpiece of that community engagement and partnership building. The second main goal that we're doing is disseminating research and resources and knowledge to the autistic community, to healthcare providers, and to the scientific community. So you'll keep hearing about things that our core is doing and efforts to do continuing education, to spread the word throughout the Pittsburgh area amongst a variety of healthcare professionals, and even broader than Pittsburgh, on how to improve interacting with individuals on the spectrum and other neurodivergent individuals. And then our third goal is to bring new scholars to autism research and support them along their way. And so the other really exciting thing going on is we have some funding down the line to support a project called Schools Unified in Neurodiversity, our SUN collaborative, which is in direct response to our park's priority to improve schools for neurodivergent individuals. So we have a really cool team of educators that we pulled together. They're all personally connected to neurodiversity, either as a parent or as a neurodivergent individual themselves. So we have about, as of now, we have 7 local school districts represented in this core team of educators that are going to meet together to co-develop a professional training seminar for public school educators on how to better support neurodivergent students in schools. And then we're going to, just in our first year, implement the training in one public school district, Upper St. Clair, in the 2023-2024 school year, and then hopefully expand after we pilot it with Upper St. Clair.
Thank you, Kelly. I saw that Maggie put a question in the chat. She said she was asking about other ways and ethical ways to support kids instead of ABA. You know, I think that we're in a moment right now where it's not as though we've come far enough to have you know, a ton of other options out there. You know, and I think one thing that's going to be really complicated is that for a lot of families, ABA is like the thing that they're being offered that insurance will cover at the moment. So I think part of my intention with that slide about talking about controversy, I think it kind of applies to answering this question, which is the best we can do is listen to autistic people about what they think is most harmful and try to find ways of helping, intervening, supporting without causing that harm. And so if you ask yourself those questions, am I just trying to get this kid to be like a neurotypical person, or am I just trying to get them to hide their autism? Am I taking their emotional experiences into account? You know, am I comfortable with, or do I feel like these are ethical ways of learning? That asking those questions can help to you as a clinician, and then possibly families as well, to decide whether you feel that an intervention that you're doing is ethical. More broadly, like if we're involved in sort of deciding what kinds of, especially like early interventions we could be doing that might be more ethical. I think a lot of the newer emerging, more naturalistic interventions that really put the intervention kind of in natural interactions, so things like Early Start Denver model are likely better, although you know they could have some of those problems too. And so with any intervention, I think you need to be thoughtful.
Jesse, I'm going to interrupt and just share the codes for the continuing ed credit. Feel free to keep answering questions, and then I'll be sending an email out to everyone with the codes as well, including instructions for how to set up an account if you haven't yet. And just a reminder that you will need to text these codes in and potentially complete an evaluation depending on the credit that you're getting within 24 hours. Just a reminder for that, but that'll all be included in the email.
Thank you, Olivia. Jen, in response to your question, you were asking about what families are choosing for young children, either in addition to or when it's not ABA. One thing I think is happening that can be good is like thinking about, if parents are thinking about like, what are my specific goals for my child, or what is my child struggling with the most, then that might lead them to specific types of interventions that like focus on that particular aspect. So like, if sensory sensitivities are like the #1 challenge a kid is experiencing, then like seeing an occupational therapist might be, you know, the best thing for that particular, you know, piece. I think the other oh, sorry, go ahead.
Oh, I was going to say, yeah, that definitely helps. I mean, I think part of it is I've done ABA for a really long time, and there are lots of controversies, but ultimately, if you're following the 7 dimensions of applied behavior analysis, they should be beneficial. Like people should always be looking at the social validity with the family, but I get that sometimes it doesn't happen. I'm sure even in our own programs. But yeah, I just wondered because especially now we have a lot of families that contact either TEEP or EIBI, And we only have so many slots, mainly because of staffing. It is very, very hard right now to find direct line clinicians. And so we're often referring out or giving other ideas. And so if there is anything that anyone's aware of that could be shared, that would be great, because these are basically families that are looking for IBHS ABA. And so we want to make sure, you know, if there's anything new. I mean, most are also doing either Alliance or early intervention through DART or Pittsburgh Public and additional therapies. But that would be great.
Thank you, Jen. I really appreciate that. I think it's exactly right. We're not in a place, unfortunately, yet right now in society where there are a lot of other options being offered. And I certainly think it's still like an empirical question whether, you know, nothing is better than something. And that's why I think that there's some subtlety to the way we probably have to have this conversation with parents right now. And like you were talking about, like if we're aware of what the controversies are, the way that ABA can be really problematic and not fit in with, you know, you put it really nicely, like the family context, but also, you know, autistic goals, then maybe we can, at least in the current environment and what we're stuck with, do better. So I don't have like a silver bullet, unfortunately.
That last article I just put up kind of gets at that. Like, I think maybe I believe that the ABA that we offer here is not really doing what has been criticized so much. And there's a big range of ABA, and there are ways to like take those concerns, listen to them, and think about how the programs are developed. It's just kind of, it was an interesting article written by a parent who's a BCBA. And then went through this process with her own autistic child. Just kind of an interesting piece if anyone wants to read it. I know we're out of time, but if people want to stay on for additional questions, we can try and summarize all the things in the email with the continuing ed information. Thank you. I just want to say thank you to everyone who's presented, and Garrett does have a question that was earlier in the chat. I don't know if you three have a chance to address that, maybe Elizabeth especially, about autistic resources here at Pitt. Do you mean like for Pitt students, Garrett? I don't know if you just had to hop off.
Yeah,
I lost track of you.
I'm very curious about that. I've had very close experiences with people with autism, and there are some people I know who are definitely looking for some sort of place where they can get the support they need. So if you have any, I know you mentioned some sort of Society of Autistic Students. Could you go into a little more detail about that if you have time?
Yeah, so there's the Pitt Autistic Students Union. They meet both over Zoom and in person. I can't remember if it's every other Friday. And there's also like a Discord channel and email groups. It's just a really good place to like talk to other people, also kind of going through undergraduate and graduate school, struggling with a lot of the same things, getting advice. There's also a few offshoot groups of that. Like there's one about disability advocacy at Pitt in general. And also groups for like executive functioning support. I know that our student health services, like the counseling center at that, offers a group therapy for people with ADHD, which often overlaps with autism. It's like a group therapy of support with executive functioning and things like that. And then also, I believe they're doing ADHD assessments starting February at the Student Health Services Clinic. Aside from that, there's the disability like resources and services. They do events every so often and can kind of help get accommodations. Yeah, but I would say the Pitt Autistic Students Union is the main one.
All right, thank you very much. And I just want to say great presentation. I really liked it. Thank you so much for sharing all this information. I feel like this is something that people really need to know about.
Agreed. Really great.
Thank you, everybody, for coming and engaging.
Thanks, everyone.
Yeah, thank you.
Olivia, keep the meeting on for a minute so I can copy all these links.
Yeah.
That's what I'm trying to do right now.
Oh,
too.
okay, good.
I'll
Yeah.
go ahead and stop the.
Active chat. Yeah, you can
Recording
stop
if
the
I can.
recording. Thank you guys. That was wonderful.